Hello and welcome to our webinar today. Thank you for joining us for our webinar, Time and Effort Reporting for the Ryan White HIV/AIDS Program Parts C and D. My name is Anna Ludwig and I'm the Training Coordinator at Health HIV. We're very excited to present this webinar to you today. Time and effort is a very important physical health topic, especially when talking about compliance issues, and it is a common HRSA site finding. So Health HIV houses our Physical Health Program, which is the program that is bringing you this webinar today. Health HIV has 4 core capabilities: capacity building, health services, research and evaluation, advocacy, and education and training. The Physical Health Program, which many of you may be familiar with, is an education and training and technical assistance program that addresses the fiscal sustainability of Ryan White HIV/AIDS program funded organizations by building their fiscal management capacity. We design and implement regional trainings. Most recently, we held one in Fort Worth at the end of June, and we also conduct individualized technical assistance. If after this webinar you would like more individualized technical assistance on this topic or any other physical health topic that we might offer, feel free to reach out to me directly at anna@healthhiv.org, or you can go to our website and fill out an official request form. The slides today will be available. They are available. If you go to the folder on the bottom right, you can download them. In there, we also have 2 time and effort reporting tools and our evaluation. Please be sure to take the evaluation before leaving the webinar today. The webinar is being recorded, so we will have this on our website within the next month, and it will also go on the Target TA Center. We encourage people to ask questions. You can, as I see many people have already used the chat box, you can post your questions in there throughout the webinar, and we will have a question and answer session at the end. So yeah, this is an example of the chat box. You can also individually chat us if you have a question you do not want the whole audience to see. So our learning objectives today are to review uniform guidance as it pertains to time and effort reporting or timekeeping, describe industry practices for timekeeping, discuss the consequences of noncompliance, indicate time and effort requirements that most impact Ryan White recipients. So I'd like to now introduce our 2 physical health presenters, Paul Calabrese and Jana Collins. Paul Calabrese is a senior manager at Rubino & Company, and we'll be talking about the regulatory compliance with the uniform guidance. Jana Collins is a research protocol manager for HIV programs at the University of Kentucky Bluegrass Care Clinic. She will discuss time and effort from a practical, everyday perspective, talking about her own experiences and implementation.
Quickly before we begin, we wanted to just introduce how time and effort is monitored, specifically for Part C and D. As Paul will be speaking in a minute, the regulations come from HHS, but Ryan White, of course, in all of its guidance also provides requires monitoring through the Ryan White program. So I'm sure many of you might be familiar with the Part C and D site visit tool. And if you look in that tool, they ask a number of questions related to time and effort. So when they come and conduct a site visit, these are the questions that they'll use to assess whether your organization is compliant. So for example, are employees required to complete time and effort reports? Are the time and effort reports reviewed and signed by the employee supervisor? Does the recipient have an adequate system to verify that the actual time worked is consistent with the allocations of time and effort included in the Ryan White budget? And are the workload reports, for example, the number of primary care visits, consistent with the allocations of employees' time and effort? So we'll be going into all of these in a lot more detail today, but I just wanted to start by talking about, there's the HHS uniform guidance component of this, and of course the Ryan White component of this, and how the 2 of these work together. And I'm now going to turn it over to Paul Calabrese.
All right. So let's get into the details. And as Samantha correctly said, there are 2 levels here. It's like a macro level with the HHS uniform guidance for HHS awards, and then there's the programmatic detail requirements through Ryan White fiscal monitoring standards. And so there's these two levels, but we got to start with the macro because we want to follow the kind of timekeeping reporting requirements that are in the uniform guidance. And we start with a bunch of words. And so what our goal today is to bring out not just a bunch of words, but practical standards, something that you can actually use, that when Jana gets into it, she's going to show you the nitty-gritty timesheets and show you how it actually works in the Part C and Part D environment. And my goal today is to show you just the very beginning concepts. I've dealt with time reporting at many different places for many different years, and the government's very, very concerned that there's an accuracy in that time reporting. And actually, when we have talked with some of the institutions and agencies out there in the Ryan White world, there were very disparate types of time reporting requirements. So let's try together today to understand time and effort and what are those specific requirements. And the beginning is, as you know, the government really wants actual time cards, charges. So whatever you did for that day or that period of time, there has to be an accurate reflections from it. And so we have to develop certain internal controls. You may have an electronic timekeeping system, which is perfectly fine, or you may have manual timesheets, but you must have some kind of form which becomes the basis of an internal control to force you, in a sense, to comply and put down your time and effort, even down to a daily basis, because you may forget. And then to make sure that they're properly allocated to other jobs and projects and activities. So the government wants you to know not just what you did for federal work. They may not care the non-federal work, but they want a sense, can we reconcile and say this equals your total workday? And is the requirements incorporated in your official policies and procedures? So you have something that's maybe it can't just be a general timekeeping process, but something very unique, very specific, and adapted to your organization and to the Ryan White program. So time and effort must have a review process. Employees and supervisors got to look at those hours. Even when I work at a public accounting firm, at the end of a period, people are going to look at my time charts and say, what is Paul doing on this effort? And it's the same thing here. Supervisors have to look because they see the total big picture. And they want to make sure, are people attached and charging the correct effort, the correct grant effort that is there. You may have sponsored activities, you may have non-federal activities, you may have a variety of activities at your organization. So we got to make sure those reports equal what are your actual time work, and most importantly, what's billed, because there's something called the False Claims Act we'll talk about later, and we want to make sure that we're complying with that so that everything goes to the proper project code. So in a sense, people should know, well, these are 4 or 5 codes that we may potentially charge. This is what I do, and I know, and my supervisor and management has told me these are the only couple of efforts that I can charge. I would never be charging something that doesn't relate to the work that I'm doing. The interesting thing about the federal rules, and you might say, why don't they give us a specific timesheet or something? They just say the time and effort reporting is important. They don't want to prescribe a certain style or method of reporting. And today, thanks to Jana's effort, we're going to get a lot of specific things that will apply to your Part C and Part D efforts. But there are new certifications. Actually, those certifications have been around for a very, very long time. And basically, when you're signing these timesheets, you may not realize it, but you're under the possibility of the False Claims Act. And False Claims Act basically is when you put your time and it's recorded to the system, if the hours were deliberately incorrect, then your organization could be assessed fines and penalties, and that's not a very good thing. So you can see these certifications are very serious, and HRSA has looked at them, and they want this incorporated in this training process, and that is that you certify the best of your knowledge, your above allocation, time expended per federal, state, and other programs are true and accurate, and that there's no false, fictitious, or fraudulent information or omission of material fact, that you could be subject to criminal, civil, and administrative penalties for fraud, false statements, and false claims, and they are very, very serious. I've seen this happen, and it is not a pretty process. So be very, very careful. Treat this as something very, very important. Time and effort, the basic principles, you got to report 100% of your time. In some worlds, they used to call this total time reporting. But basically, you can't exceed 1 FTE, full-time equivalent. It should be only up to 100%. And you might say, well, I charge both federal and some non-federal. And we understand that. The government, to understand the integrity of your time reporting system, needs to see what you charged on their federal award, specifically Ryan White, but you may have another HHS award and the requirement to charge those specific grants as well. And then with non-federal sources, as far as HRSA is concerned, you could put that all lumped into one balance or one column and say it's non-federal. But, and not a bad idea, if you've got to go through this process, why not track all the charges? And some organizations, they want to know whatever things you're charging, and so they want to see, well, I'm charging program A or sponsored activity B or something else. So just be open. Every system is going to be a little bit different, but the key is actual time charging. So they come up with the standards for documenting personnel expense. And they want you to comply with your established accounting policies and procedures. So in this world, you're going to be carving out something that's very, very unique. Unfortunately, the time and effort reporting for Ryan White and for the uniform guidance are not off the shelf. This is going to be something that's very unique, very uniquely designed with management, with grants administrators, with accountants, so they understand all of these different requirements and putting together your unique time and effort system. But there are certain standards. If you're charging more than one federal award, you need a timesheet. You need what they call a distribution of time. If it's a federal award and a non-federal award, which you just talked about, if it's an indirect activity like administrative, like finance, executive, administrative duties, or something of that nature, and direct, you must charge both of those. Then it gets into something very complicated, that you may even be into two different indirect cost centers like facility, and you may be an administrative in that rare case, and so they would want you to charge those. And the last is something that most people don't take seriously, and that is if you do an unallowable activity with a direct or indirect activity. Unallowable activities that normally are charged direct are fundraising, lobbying, public relations, and I doubt many of you would be membership organizations, but that would also fit in there. And this would be you would see this a lot with in a small organization with executive directors or executive personnel who have technical capability or are charging direct, but they also have indirect capabilities, but they're doing some PR, or they're your rainmaker. Well, if it's fundraising, development, or lobbying, it's got to be charged to a direct activity code. So just be aware of those kinds of things. Budget estimates, budget. Budget is something that's very, very important. We've got to follow the budgets that we have in our grant documents. But even though you've been given budget estimates and say you're prorated 30% here, 70% there, you don't need to do 30% one day, every day, and 70% the other day. The government would really like to see it on an actual basis. Maybe it's 4 hours one day, 4 hours and 2 hours another day to a particular program. But everything is based on after-the-fact actual charges. That is the most important thing. If you are using some kind of projected system, at some point, at least yearly, but better if it's more often, like quarterly, you're adjusting to actual. So if you're using something like a standard cost process that's been approved, then you need to adjust at least quarterly, because it'd be hard to keep track of what's actual and what isn't. The best method is just to do actual, because then there's no adjustments generally that are needed to be accomplished. They also talk about in the university environment, institutes of higher education, and they may permit you to do percentage distribution of total activities because they have some unique thing called institutional-based salaries and for professors, and it's a little bit different. But some nonprofits are trying to just say, well, I'm doing a percentage time. The government would really rather, the best ideal is actual labor actual hours times your effective pay rate, which of course management would keep. So if you can do it on an actual hour basis, now maybe later after those dollars are developed, they may base it on certain allocation percentages for allocating occupancy or something. But initially, the ideal is hours, actual hours times your actual pay rate. And this is something we've seen. Some of us have been talking with some of you in the field, and we noticed that some nonprofits actually are using time studies. And time studies, really under the uniform guidance, are only permitted for state, local, or tribal units of government or municipal city. They're not really necessarily meant for nonprofits, and we're seeing nonprofits doing it. It's kind of like they estimate their time and it becomes their estimate for, let's say, a quarter. And again, that's really not what the government's saying. But if you're using it for a budget process, that would be different and acceptable. Responsibility. What are the roles and responsibilities of people that maintain these time reporting procedures? So you're going to have somebody that's a financial management administrator, could be a grants administrator, could be different functions. Everyone has that's the uniqueness about grants in the whole world. Every grant's a little bit different, and how you manage it in your organization may be different, but there needs to be a responsible person that's in charge of the procedures, because they are the internal controls. They keep people on the right track in their timekeeping and time reporting. So they would be responsible for providing employee orientation, especially for these unique Part C and Part D and all these different kinds of tracking, the HRSA additional tracking of information and recording of information that they want you to do. They may train, and they may also perform a test, a timekeeping review. Some people call it a floor check in the old vernacular, to test to see, are you keeping your time on a daily basis? It is so important. Management is responsible for ensuring that it's a compliant system, and of course employees are responsible for complying. A big concern, probably the biggest fear that the federal government has, and I've known this because I've been working with them for so many years, is they're very concerned that, let's say, a grant or a funded vehicle is run out of money. And so someone would direct you to charge something else than what you would normally be working on. And that would be an absolute fraud. That would be totally wrong. You cannot mischarge. You cannot charge something other than what you're supposed to be working on. And if it goes over the budget, then that's up to the management to deal with the government. And if it goes over, it goes over. Better to have an overrun. Better to go over than to do something improper. But there is a website and there is a location for the Office of the Inspector General. Now, some organizations, what they may do is they may have an internal counsel, and you may want to start there, but the government would prefer that you report it to the HHS, Office of Inspector General. And we've seen, unfortunately, some universities that were having difficulty in tracking their time and effort reporting, and they got some severe civil penalties, dollars in the millions. And so we don't want that to happen for our people. And I know HRSA doesn't. Really, HRSA is here and all of us to help you do the best job you can so we don't get into these situations, something that we avoid. So my last slide today, and as Jana will be getting up and getting ready to speak in just a minute, the common issues that we're seeing, or common problems, is time and effort reporting based on budget versus actual, and the two not linking up. You know, obviously in the end, you've got to follow your budget. You don't want to exceed it. But if you're prorated between two different projects, you know, don't just do 3 and 5, 3 and 5, and 3 and 5. Do what your actual time is and watch it to when you get to the max. There could be weak internal controls, no source documentation to support salary and wages to a federal award, so we would be concerned about that. Source documentation, if you don't have documentation, as one auditor said, A133 auditor said, or single audit, if it isn't in the file, it isn't. So you got to be careful about that, because your organization will be audited one way or another. A change in position or job responsibility funding may result in different kinds of reporting. So you may change from one effort to another. Do you know now what the new charge number might be? And the last is, you know, multiple efforts, multiple grants or projects not being recorded separately. You're supposed to charge every code uniquely.
Just before we move on, we have a question that's really relevant on the bottom that I want Paul to be able to address, which is, can you elaborate on the statement regarding time studies not being permitted for our grants? Can you talk about that a bit?
Yeah, it is just simply a requirement in the Uniform Guidance for HHS awards. If you think about it, when you do a time study, the way I've seen some time studies done is sometimes it's either done for a half a year, or quarterly basis, and then all the charges from that point on are done on that basis. I suppose if you had one effort, it may not be a big deal, but when you, except for a paid absence. But the problem is, if you have multiple efforts, there's no way you're going to really know the actual time keeping. And there are sophisticated and different systems for state governments where they do permit this. It's kind of like a sampling, a testing, for which they then project. They have not allowed this to be for nonprofit organizations. And when Michael Schenkel back there, and I were discussing with some of the people, we found that a lot of organizations were doing time studies. We're just trying to bring this to your attention. There are citations in this thing, and we encourage you to go back and read them, and then I'm sure the organization would help with a TNA or something else if you needed to adapt to that.
Yeah, so a lot of folks do use time studies for budgeting purposes, which is a great idea. If you think about, for example, how do you decide how much time someone should be spending on a particular federal award? That's when a time study is a really great activity to do and say, okay, it looks like this amount, so let's budget that, because again, budgeting basics are really critical. But the problem is that then you can't say that these are the actual hours that you're working. So if you do a time study kind of twice a year, then in that particular time period, that time study might be valid, but things can fluctuate so much. And again, projects can change, funding can change, positions can change, that you're not recording actual hours worked. So for budgeting purposes, it's a great exercise to demonstrate actual hours worked. It is only allowable for government, so state, local, and tribal units of government. So that's a great question. We might answer some questions along the way. We're going to try and save them at the end for the sake of time, because a lot of these will be answered as we move through the presentation. And so now I would like to turn it over to Jana to take over the next part of the presentation. Thanks.
All right, thank you. Thank you for that first half of the presentation, and Samantha, thank you for the introduction. So I want to say that this is not easy. I do want to point that out first. Like Anna said earlier, I'm with the University of Kentucky, and we have a Ryan White Part B, C, D, and F program. And so we have people who are singly funded. We have people that are multiply funded, and this is difficult. It's difficult to figure out the best ways. And I think the important thing that I want to stress as we go through this presentation is that every employee may look different. One time log might not work for everyone. And so that's, practically speaking, what I think everyone needs to think about for their program, that each employee is different. They have different roles. They have different types of documentation that they could use to support time and effort logs. And so if it already exists, I think it's best to use that than trying to create something from scratch to support how time and effort is reported. And so that's what I'd like to talk about for the rest of the presentation. So as Paul said, it's recommended that these timesheets or logs are completed on a daily basis. The examples that I've included are all electronic, so if folks are going to use them, they can keep them up on their computer and use them through their daily activity, or be able to complete them at the end of the day. When you look at waiting till the end of the pay period, or a week, or 2 weeks, or a month, the accuracy obviously declines significantly. So maintaining time on a daily basis prevents inaccurate timekeeping and prevents potential false claims. And as Paul mentioned, there needs to be a process for verifying and certifying. So just having the employee complete the time log is not enough, but it really needs to be reviewed and signed by the employee saying, I certify that this is what I did, and the supervisor also saying that they can vouch for the fact that they know this employee's activity and that they know this is correct. And then you also have to have suitable means to verify the accuracy of the time and effort report, and that's what we're going to talk a lot lot about today is workload reports, meeting minutes, project management tracking, and things such as that. The other thing, of course, that we have to mention in terms of Ryan White programs is the cost categories. And so all of these time logs are set up with the cost categories in mind, because when you're having to track time and you need to accurately reflect percentages and category caps, it would benefit you to have your time logs also be spread across the cost category so you have an accurate reflection of what is occurring on the ground. So I want to talk a little about support documentation, particularly for employees who see patients or have some kind of routine documentation of patient notes, registration records. You know, those things can be attached to time and effort logs because they'll reflect actual time worked. You know, if you have a nurse that's rooming patients, then that registration information is showing what patients are being seen. Are they all HIV? Are some of them Ryan White Part C patients? Are some of them Ryan White Part D patients? And you can monitor the work of those clinical employees using some of those forms to help you complete the time and effort logs. As stated before, unacceptable supporting documentation is really estimates and prorates. You know, that's how we set our budget up based on what we feel like to be accurate estimates of what it's going to take for each of these employees to complete the work plan that we've laid forth. You know, we're going to need this much time from this physician to see patients. We're going to need this much time from nurses to get patients in and out, to do adherence counseling. But really, the budget is estimates. And so we can't use just those percentages and just those FTEs that were based on a time study or based on previous numbers. We actually have to have support of the actual hours that are worked. And as mentioned, time studies can't be used outside of, you know, government and public health departments. So the question you really need to ask is for positions that have multiple funding, you know, how is the amount of salary charged to the grant determined for this position? And then that supporting documentation really needs to reasonably assure. It can't be, you know, 75% of our population's Part C and 25% of our population's Part D, and so that's how their time is charged. But in a given day, you may have a women's clinic and see all Part D patients one day, and so that day really should reflect that 8 hours were spent on the Ryan White Part D program versus splitting it, you know, 75-25 Part C and D. The expectation is that you're reflecting the hours as they are actually happening and how it's really living and breathing in your program. So thinking about some supporting documentation per position, and we'll go over this in more detail, but, you know, for billable patient care providers, looking at registration lists and arrived appointments, electronic health record notes, billing reports, I think those can drive the time and effort logs. You know, it's probably not realistic to ask a physician that's funded by your project to log their time. It's probably not going to happen, and it's not a great use of their time. But you can use their patient reports, who they're seeing, how many are HIV, how many are non-HIV, how long they spent with patients. You can use that information to drive the logs to support the time and effort that those physicians or medical providers are charging to your project. Again, for non-billable patient care, you know, it really looks the same. If you have medical case managers, dietitians, pharmacists that are actively seeing patients or talking to patients on the phone, making service encounters, making notes. Again, while a log may not be feasible as they're in the patient care areas, they're in the clinic and in and out of rooms, if you can use those existing lists to drive the log at the end of the day. You know, I saw 15 patients today. 2 of them were non-HIV, you know, these were Part C, these were Part D patients, and then you divide your time up that way. It's a more accurate reporting of what actually happened versus, you know, what may be on a percentage on the budget. So really looking at these things that exist. Honestly, the one that I have the hardest time with and that we are as an organization having the hardest time with is administrative staff. Because we don't have patient reports, we don't have encounters that we're able to track off of. So this has to be kind of a more live, living document where administrative staff are working on things. They're working on reports. They're managing finances for projects and really accounting for you know, increments of time that are spent on these different projects. So each of the examples that I'm going through look at these different types of providers and what type of log may work for them. As was mentioned before, these logs are included in the folder and can be, used or changed to match what would work for your agency. But this is just kind of what we're trying to work through at our program to support our time and effort for these different types of positions. So the first scenario we're going to look at is a Part C and D program, just setting up scenarios for each one. We're going to say this is an ambulatory medical center that operates as part of a university-based hospital. We're looking at a principal investigator who's a physician. They record time monthly. Supervisors don't really review their time. And this particular employee is supported by Part C and D funds. And the important thing to note is that they have a total effort on each of these projects, but it's also split out by core medical, continuous quality management, and administration. So when you have an employee that is split across cost categories, it's important that your log reflects that as well. So as we had mentioned, there are different things that we can use. And when you're looking at these positions, sometimes the medical director is also the chief of the division, and they have a lot of responsibilities. And so adding a time log to them may not be practical. So finding ways to build in logging time to what they're currently doing is kind of the best way to do it. So this is kind of the process that we worked out with our medical director and looking at when they see patients, who are they seeing? How many are HIV? How many are non-HIV? How many are HIV low-income uninsured that are Part C eligible, Part D eligible, and looking at their productivity reports. And then for like the administrative and CQM, we really wanted to use the weekly calendar as the driver. So when meetings occur, even if they're on the fly, putting those in the calendar so you have that printout that says, on this day I met with this staff member and this was my administrative time. This is when our continuous quality management meeting occurred. And that way you have a written document of what that employee was involved in that you can just print out and attach to a time and effort report. So here's an example of maybe what this would look like. This is a monthly time and effort log, so each time and effort log is a little different. I have some biweekly, some monthly, and some daily. But you would look at this physician's time and you would say, on Monday, they were in clinic, they were seeing patients, they saw patients for 4 hours, it looks like, and so 3 hours were Part C patients, 1 hour was Part D patients, and then there was administrative time for both of the grants, and so it's split across that Monday. But you could use to support that the arrived appointments for that physician and then the weekly calendar. So you have that supporting documentation that you can go through and actually support exactly what that physician did for the federal project. And you'll see, as Paul talked about, the non-federal funding is entered as a funding source, but I didn't break it out any further than Ryan White Part C and D, and that's really up to your organization. As Paul said, if you're going through this process anyway, it probably wouldn't hurt to go ahead and break them out so you have a realistic, view of everything that you're doing, but sometimes it's not practical or sometimes that's really not the desire of the organization, so I really just have C, D, and non-federal broken out for this employee. So really the recommendation is to have the ability to track time daily, even if they don't have to submit it that often. That's kind of key. If the supervisor may be not looking at it, there still has to be a process to track that time and for the supervisor to approve it. And so the supervisor would have this time log and the productivity reports to verify that the time is worked. The note was that, recipients must document accurately that they are compliant with the rate limitation for employees whose salary exceeds the executive level 2 cap. You may not do that on a time log, but that's something that you need to keep in mind in terms of that requirement for our programs. So looking at the time and effort for scenario 2, this is going to look at an administrative person. Again, for this staff person, they're using an electronic time system where they clock in and out every day. And then the supervisor signs up on the timesheet every 2 weeks. So the budget was determined based on a predetermined percentage of effort, and so this employee is funded by 2 projects, Ryan White Part C and D, and again, they're split out across cost categories. So they have some quality management time, some support services, and some administration. And this, I think, is where it does become a little more difficult to to track time, and it's not as neatly laid out there as people who are seeing patients and making notes of what occurs there. Things you have to consider is the role per funding source. You know, for Part C, a person could maybe be all admin, but Part C, have CQM and support services. So you have to consider what their role looks like for each funding source. And also sometimes duties and roles simultaneously serve multiple parts. You know, if you're having a CQM meeting and there are C and D things going on in there, then your timesheet should reflect the fact that there are C and D things happening, and you can split that up based on whatever percentage is appropriate. Sometimes if you have financial people, if they're paying bills, or if you have data entry people, maybe looking at what they entered data for that day and the associated funding sources. And again, using the calendar, looking at standing meetings, looking at supervision that happens as it occurs, and making sure you document that in your calendar. That can help you drive your time and effort log and for it to be accurate. And again, so I thought the weekly calendar review is definitely possible, monthly logs of standing meetings. But for this employee, I wanted to give them a daily time and effort log. And so this is maybe what it would look like. This is one day for this person, broken out by 15-minute increments across the different cost categories for Ryan White Part C and Ryan White Part D. So basically, the administrative person could have this pulled up. They could enter increments of 15 minutes, and it will give you kind of a daily review of what percentage of effort was spent on the different cost categories for the different grant projects. And then in this particular one that I gave you, there's a summary log at the end of the week that details how many hours were spent per day, and then for the total week on the different cost categories and how the percentages were broken out. And it includes the certification, certifying that this is correct and that we've expended time as we have certified for federal and state governments. So just remember that the budget has to be charged according to actual hours worked and not allocated time. And so that the log would drive that. So for scenario 3, we're looking at a community-based organization that receives, again, I'm doing Ryan White C&D funding for all of these just for practicality purposes, but this employee uses paper timesheets that are completed biweekly, and the supervisor signs off on them. Budget is charged through hours recorded, and you have a medical case manager that's 100% federally grant funded on 2 projects. So the medical case manager for this example has one cost category, core medical or medical services delivery for Ryan White Part C and D. And again, we've kind of talked through this, but using things that exist, rather than creating them from scratch to fill out time logs, is probably best. If you can have service encounters that you can print out for that person, who they saw, what programs those patients are eligible for, how many low-income uninsured HIV patients we're seeing versus HIV affected or non-HIV, and being able to break that information out to support your time and effort. And this time and effort log, you may not require the daily management that an administrative person. So this is a 2-week biweekly example where you have an employee who has their time split on core medical services and medical services, and it's broken out to support those percentages. And as Paul said, you wouldn't want to do 3-5, 3-5, 3-5 every day, but really looking at what's happening on the ground that day. Who's going to be in clinic, and how is your time separated based on the patients that were served for each of those days. And so this is kind of a step back from the daily, where you can use these logs, review them at the end of the day, complete your log for that day, and then move on for the next day. So time and effort, the scenario 3 would be compliant as long as the supervisor verifies the actual hours worked. So as long as there was that backup documentation to demonstrate the patient served and the duties that were carried out to justify those hours. So for time and effort scenario 4, again, looking at a community-based organization with C&D funding, using electronic timesheets that are completed biweekly with a supervisor signing off every 2 weeks. Again, the budget's charged based on a predetermined percentage, and the clinic nurse in this example, is funded 20% Part C, 10% Part D, and 70% through agency funds. So this one, again, I wanted to complicate a little, having core medical services and CQM, two cost categories figuring in for this employee. Again, looking at meetings, the calendar for any CQM efforts that might occur, and it might not occur one week, but it occurs the next week, so you'll have to look at multiple logs, I guess, to get probably an accurate time and effort tracking for this employee. But looking at patient loads, activity reports, what patients are being registered, who the nurse is meeting with for adherence management and things such as that. And then this time log considers other agency funds. So if you have an employee who's working on C&D, and then this timesheet kind of gives you an area to enter hours for the other agency funds, looking at productive hours worth in addition to non-productive hours. And each of these time logs has kind of a signature place, so you can say that you certify to the best of your knowledge that the time was spent performing these federal, state, and program duties, and that it's true and accurate. And then the recommendation for this scenario is that you're using these time logs to charge to the Ryan White Award according to actual hours worked and not just allocated time. So what I really wanted to get across in each of these examples is that, each employee is different. Each time log probably needs to look different and may be completed at different times. It may be completed at the end of the day for people who are seeing patients, or it may be completed, hourly for people who are doing administrative programs, and they're kind of all over the map in terms of what they're doing for the different projects. So we have one more example looking at community-based organizations that don't directly fund staff positions. So their salaries are funded through reimbursed cost units of service. Employees use timesheets based on their actual hours, and the supervisor reviews them. So how does the supervisor verify their hours worked? And what you really want to look at, again, is maybe using calendar, using workload reports, and verifying the actual hours worked, so you can justify the hours that are charged to each of the projects. As mentioned before, budget projections are really a separate process and don't line up with what actually occurs, particularly when you're on a fee-for-service basis. So in terms of like a time and effort checklist, what you want to look at when you're putting a process together, a budget will have estimated FTE and compensation. You get an idea of what you're doing through a time study or through what is doable for your program in terms of the patients that you're serving. But the time and effort log, these timesheets, time cards, have to reflect actual hours worked. So you want the supervisor to review and verify actual hours worked and give approval. This needs to be reconciled with the budget, and so that the time charge reflects hours worked and not just the hours estimated. And then you need to have a time and effort reporting policy and procedure that kind of lays out how each employee, depending on what they do, what services they provide, the supporting documentation is going to be required to be included with their time and effort log, and how that will be reconciled with the budget, what documentation will be used to support the accuracy of the time and effort. And then, maintain support documentation for site visits and audits. As was mentioned at the beginning, when I serve as a consultant for HRSA as well, so when we go on site, we are looking for time and effort reports and how you are supporting the FTE that Ryan White is paying for. How are you using provider level reports? Are you using time logs? How are you supporting the FTE that's charging to the project? And so you'll want to have those in hand in the event of a site visit or an audit, so you can support what's being charged to these projects. So there are a couple links to resources that were used for this presentation, and I will turn it back over to Samantha and Anna for the next section.
Thank you so much, Jenna. That was great. We have some really good questions that I'm excited to get into. I encourage other folks to keep typing questions in as you see them. Before I get to the questions, I just want to reiterate that we've recognized that this is an onerous process, and we present these to try. Jenna's laughing over there, and we present. We're presenting these tools to try and help you along. If anyone already has a system or has heard of something else or is doing something that you think is working, please share it with us. We are always looking to be able to share resources with other folks. We got a message that was asking for some sample time and effort policies. We are happy to share them with you. Again, if you have some that are good time and effort policies, please share those with us as well. So I'm going to start, again, asking some questions to our presenters, and if you have them, I see that some folks are still typing them in, so keep going, and we will try and get to all of them. If there's something that we can't answer over the webinar, we will definitely follow up with you in person. So our first question, how is a time study different from a floor check? And this is for Paul.
A time study is something where an organization voluntarily prepares and based on like a 2-week period for a quarter or a half a year, what they anticipate based on the real time for 2 weeks. And then they use that going forward for the whatever period, a quarter or semi-annually. But a floor check is a unique term. It comes from actually the government contracting world where you had manufacturers. And basically because auditors had to test and just make sure people were there on the floor. So basically when they were manufacturing and doing tooling and assembly and all these unique things, they would go and say, well, this person, Susie Smith here, John Doe, are they there? So all a floor check really is an outside auditor coming in and confirming you indeed are there and you're indeed charging what you say you're charging.
Great, thank you. So what happens if someone is 100% allocated to the program? Why do we need to document this time if that's their whole job?
Okay, these are great questions because I know a lot of people are struggling with them. If someone is charged 100% of the time, and let's just say that was the only person, then if you look back at the rules in the earlier slides, 9 to 18 that I presented, you would technically only have to have a basic certification. The problem is there are others that are charging more than one program. And therefore, if you have one that's on one program and you got 25 that have multiple programs, the exception to the rule for internal controls makes it very difficult because some people, like we said, come off and on grants and programs and so forth. If this is like just you're in a research mode or you're doing something so unique and that's the only thing and you're not doing non-federal work, then you might be able to make that case and the HHS uniform guides would support you. But again, are you the exception to the rule? That's the question you have to answer.
Great. We have another question on allocation that I think is sort of related while we're talking about that. What happens if someone works 90% on the grant, but they're only budgeted for 60%?
Okay, now that has more to do with if you're working the true time, you should charge the true time. So if you really are working 90%, the government wants you to charge that true time. The question is now a matter of funding in your budget that maybe you may be over, but just so many possibilities here. For example, say you're over by 30%, but say someone else is under by 25 or 5. Then it's up to your grants administrator to consider doing a budget realignment with your either your prime, the state, or with the federal government directly. But if it's not covered, and that's all you have, then your organization will only be able to recover up to 60%. But I do believe you're doing the right thing to charge the true total time. Hopefully that answers that question.
Yes, thank you very much. So one on signing off on allocations. Are we okay if we have people sign off on the allocations with their paychecks supplemented by regular time study?
Say it one more time.
Okay.
It's a lot.
So are we okay, basically, are we compliant if they have employees sign off on the allocations with their paychecks supplemented by a regular time study?
Well, we've already said that unfortunately time studies are not accepted. Mm-hmm. And then you're saying the allocations, and then are these allocations actual? Are these allocations budgeted based on the time study? It's not clear. And then you say paychecks. Why not just do a timesheet? It sounds like all that you're asking to do is even far more complicated than just a timesheet. I understand you have a certain method in process. So if you start to make changes, it's going to be a transition and it's not going to be fun. But I think if in this case you need a timesheet, it would be simpler to me.
Right. There are some instances where, for example, we work a lot with recipients who are monitoring their subrecipients, and they sometimes ask for time and effort logs to be submitted with paychecks so that they can look and confirm that kind of the amount that they're being paid makes sense with the work that they've been doing. So that would be an example when submitting your paycheck as support documentation would make sense. And when HRSA comes in for a site visit, they also will start with the payroll and then look backwards to time and effort. So maintaining all of this as documentation is really important. But to answer that exact question, then unless it's a government, right, time studies wouldn't be allowed to demonstrate actual hours worked. And again, a timesheet would probably just be easier.
Yeah, and what Samantha's correctly saying is that's an after-the-fact on-site visit, either by an A133 auditor, CPA firm doing it, or by HRSA or some other, or Prime monitoring their subs, that subrecipient monitoring activity. That's totally different. When you're doing your timesheets, no one's expecting you to have pay stubs and so forth. Plus, it's private, personal information, and you wouldn't want that out there. So the timesheet's only showing you your hours. It protects that private information.
Thank you. And we have another question here on certification. If our system of internal controls includes a review and certification process that is documented electronically, are we still required to have employers and supervisors physically sign?
I believe not. I believe if you have electronic signature for both the employee and the supervisor, showing that the supervisor did indeed review it, then that would be an acceptable thing. In the future, CPA firms or public auditors are looking at electronic systems, and they're getting experts to check those parts to make sure that the electronic internal control is doing what would be done in a manual. But yes, if your system does that, and there are systems that do electronic time reporting, they are perfectly acceptable. One last point, the Uniform Guidance in its writing about a year or two ago stressed that electronic systems are fine, they're preferable, they will save you lots and lots. I know there are expenses and so forth to them, but the investment may save time in the long run.
Great. We have another question, and Jenna, I also would love your opinion when you conduct HRSA site visits, when you're looking at someone like this, if you could talk a little bit about what kind of documentation that they might look for. Do you need a time and effort log if we have all of the other documentation and we're only Part C and all of the work is on that grant? So I guess, Paul, if you wouldn't mind answering the question
100% charged and no other effort.
Exactly. They only get Part C. All of the work is on that grant. Do you need a time and effort log?
And they're not doing non-federal work.
Right.
Then yes, then the Uniform Guidance says that yes, all you would need is a certification or something else technically at a general level.
Right.
Because you're only working on one. If you go back to the slides, we talk about distribution of time. It's only one activity.
Right.
But there may be unique things with Part C and D.
Right. So here's where HHS, Uniform Guidance, and Ryan White wouldn't necessarily agree.
And you would need to be more specific.
You would need to illustrate where that fits in with a service category. So if the work, right. So the work that you're doing, is it direct service? Is it administrative? Is it CQM? Jenna, could you talk a little bit, if you've seen this when you conduct a site visit, what would you typically look for if someone, basically if an organization is 100% Part C funded?
Well, I'll be honest, there's not a lot of organizations that do a great job at this, so I don't have a lot of good practical examples to draw from because it is difficult. I'm sorry, I'm just being honest.
Thank you for your honesty.
So if you're worried about this, you should be, because everyone is. It's hard. But you know, what we would be looking for is how that's determined and practically shown. I think you have the same issue where if you have a person that's across multiple cost categories and you determined that 10% of their time was administrative and maybe 70% was support services and 20% was CQM, how are you splitting that up and making sure that the administrative time isn't going over the 10%, because that 10% administrative cap is something that we all have to abide by, and you don't want to just be splitting the percentages up so it fits with that cap. You have to demonstrate how that's actually happening. So I do think think you still have to demonstrate how that person's time is divided up, whether that be by calendar, by the job duties that they're doing and proof of that, or how they're seeing patients, how their support services are built into it. I still, even if they're Part C funded fully, if they're across cost categories, even if they're fully on medical services, how are you demonstrating that their full time is dedicated to the medical services for that project?
Great, thank you, Jenna. And we have a question while we're talking about kind of tracking cost and service categories here. How do we track hours for dentists that are supervising students who may be doing direct care on HIV patients in an educational clinic?
That's a great question. So are you asking what cost category to put them in, or what exact are you asking? How you're going to do it?
The question was how do we track hours? If you want to talk about it from a couple different perspectives, that's fine too. I'm sure other folks might have similar questions.
I mean, I think you should be able to demonstrate the hours the same way you would be able to if they were seeing the patients. If they're overseeing the students and the students are seeing HIV patients, then having, the workload reports or patient appointment information to support that, I think would be the same way. Now, the cost category, I'm not 100%. I think it would fall under medical service because you're providing oversight for direct care, and I don't think that falls under the administrative guidelines or CAP, but that would be more of a discussion with your project officer. But I still feel like you could use the same supporting documentation. You're overseeing the students, but the students are serving the patients, and you're making sure the patients are receiving appropriate medical care for the services they need.
Great, and I see that question from Catherine T. We will follow up with you to make sure that that is the appropriate answer. I think that was a great answer from Jenna, but again, this is where it can get a little tricky, so we'll follow up with you after the webinar once we confer to get some HRSA guidance on this, so thanks. Here's another question for Paul. If we receive one federal grant and are subcontracted under state or other funding types, do we do time and effort for staff who are fully funded under the funding, who are fully funded under the funding defined as non-federal or subcontracted pass-through entities such as states?
Yeah. Again, it comes down to this. Who's working on what? And if you have people that are split, then you need to have a timesheet. If people truly on the state-funded efforts were not, and it's like you could put a box around them and say they never touched the federal world, that's fine. Of course, there are advantages to reporting that time anyway. But if it's just one person or a couple and it's an exception to the rule and many, many others charge many different activities, which it sounds like what you have, or even just that one federal award, then it's going to force you to keep a time and effort reporting of some kind.
Great, thank you. We have one very specific question here from Leah D. I just wanted to let you know that we'll get back to you on that individually since it is a very specific question. We have one here, and again, I mentioned that we recognize that this is a bit of an onerous process, and Jenna, I'm hoping that you can speak to this a little bit from a personal level on how you manage this. So the comment or question is, I'm concerned that my large public research university will balk at us imposing these intensive time and effort tracking on top of our existing centralized effort reporting system, which is much less onerous. So do you encounter something similar, and how did you convince your institution to accept this level of effort time tracking for a subset of their employees? And Jenna, you don't have to go into detail in terms of your personal experience, but if you can talk a little bit about, managing some of these processes, what you've seen when you look at other university-based Part C clinics, and how some of them manage this process.
Okay, that's a great question. And we have, Paul and I and Samantha have done this presentation before, and the first thing I did when I started learning of the requirements and how we were going to document this for Ryan White is I went to my institution and said, is anything going to be changing to support these changes of the government rules? What is the university going to be doing to address this? And they basically said, oh, we're going to do certifications twice a year. And so I didn't really feel like that supported what we are supposed to be doing, at least from what Ryan White is presenting on ways to do that. So honestly, I haven't really tried to talk to anybody in my institution, talk them into this process. It's something we're doing internally through our project as a way to support how we are dividing up Ryan White funds across cost categories and how employees are charging their time. So we're doing it more in-house versus getting the blessing of folks above. And I think honestly on the ground when I go and review sites, that's what you see is that the university has their broad policies and procedures that we follow, but for a site visit and an audit where you get down to the nitty-gritty of what a program is doing, some of this has to be decided on and managed internally. What's best for your program based on the type of employees you have and how their effort is being supported.
Thanks so much. And Paul has a response to this as well.
Yes, I just wanted to say, first of all, I understand big universities and big institutions have their own requirements, and what you're saying is, hey, we have to run this by them and so forth. But we remember that big university can be audited by HRSA, your unit can be audited by HRSA, and then they have other funding, and the comptroller, or whatever the position is called, has something called the A133 audit or single audit, which may be done by an outside firm or it may be done by state auditors. And so they are under those requirements, and that's why we have A133 audits. It's just why we understand you have big, complicated systems. Then you got this unique program, and I would assume it's a large enough program that there are a number of people under it. Certain resources need to be expended for that group. It's like putting, again, a box around this group and saying, yes, we'll still follow the general university requirements, but we have to, for Part C and D especially, and the service categories, we've got to track at that level of detail because Ryan White programs require us to do it, because they're going to have an on-site visit, and they're going to write us up, and our university doesn't want to look good being written up, plus the CFO, the comptroller, has got to be involved with that. But if they were not to do that, if they were to say, laissez-faire, I don't care, or whatever, if that were possible, they just don't care, or they don't deal with it, you as grants admin, it's got to be someone there that's doing a finance, fiscal management, grants management function, and saying, I understand what the university is, we'll certainly comply with them, but we will add these other procedures, so when HRSA comes, my job isn't on the line for being written up time and time again because I don't even following it. Right. So I think what it is, you've got two different scenarios. You can always be more restrictive.
Great, thank you. We're going to switch gears a little bit and talk about how you track PTO, paid time off. So how do you charge PTO or paid time off to a project grant if the employee is not 100% federally funded? Okay.
And that basically also gets into the accounting system. I'm assuming most of the people here are nonprofits. Most nonprofits, and I'm sure even Health HIV does it, where paid absence is a part of the wage line. They don't have it in their fringe rate, and this may start to get more technical, but it's a part of their salary line. So what someone's doing is if I charge 50-50 between one federal and non-federal and I get some paid absence, my time is going to be charged pro rata 50-50. Right. There's an internal allocation where they keep track of that, and that is what they do. So you're allocated. So if you're less than full-time, whatever the pro rata amount of your paid absence for that period or that month that they're tracking, and usually it's a consistent method, generally done monthly, if not then quarterly or yearly, they would prorate your paid absence accordingly through the wage line.
Right. Right. Great. Thank you. We have another question here, and Jenna, I would like you to speak to this. We have many staff fully funded under Part C, but they're through different categories like early intervention services, core medical support. Does staff like this need a time and effort sheet that denotes separation?
I would say yes. I mean, if they're divided up across cost categories, even if it's only on one grant, I think you still need to be able to support how that percentage is divided out and how you're justifying it. So I don't think it may be easier because you don't have to worry about the type of patient. If they're all a Part C patient and they're funded 100%, then you really just have to monitor the time and effort for those different cost categories.
Great, and I'm sure a lot of other organizations do something similarly like this. We actually do as well. Jenna has these examples of time and effort reports, and I think the idea is that a lot of staff don't do all of the activities. Like some people might do EIS and core, some people might do support, but you could kind of have that as your heading on your time and effort log. So instead of just having, for example, Ryan White Part C, you could break it out for that specific employee, or what we do in our office is we write in the funding that we are charging, right? So on my timesheet, I have these different funding streams that I put in. So there are different ways of doing this, and I'm going to kind of continue into the next question because I think it's related. Is there a resource available to work through with recipients how this kind of documentation could be implemented? And the answer is that we are that resource. There is unfortunately nothing written yet. We're actually working on a toolkit, but the issue is that this is it's so dependent on the setting that you're working in. And so in terms of figuring out how to denote that kind of separation, how would you do that? The answer is that, we can provide technical assistance for you, and we'll certainly help identify other resources as we come across them. Unfortunately, there aren't that many available. I'm just being mindful of the time. We're going to take a couple more questions. And again, if you have any other questions that we don't get to, I do want to just reiterate this doesn't have to be the end of our interaction with you in this webinar. Please, my email address is here, samantha@healthhiv.org. We are very happy to work with you individually. We're working with a number of recipients right now on implementing time and effort reporting requirements. And, we will do it with as many as necessary. So I'm going to go to Lynn's question right now. We had a site visit in 2013 that didn't note any problems with our time documentation. Congratulations. Are these new requirements that will be audited going forward? Do you want to talk about where these Paul, where they came from in uniform guidance, and then I can speak a little bit to how they're assessed from a Ryan White perspective?
Yeah. You have to understand some things, and I know this may not give you the most happy feeling, but when auditors do things, it's a judgment call. And there were even some, and I'll be very honest with the audience out here, that had time studies. And I think HRSA came and did it, and they didn't have a problem. So it's an ever-learning and improving process. Mm-hmm. And then the uniform guidance did come out in late December 2014. So things are evolving, and it seems from what we're seeing from HRSA, they want an ability, and I know this is a lot to do, where if they've laid out a budget by a service category and they have those kinds of details, they want you to track the time the same way, and especially how you're going to track your admin gap or these other caps that are like, 75-25 if they have those, or any other cap that's a part of the Ryan White program. How are you going to do it if you cannot track them on your timesheet? So you may, in 13, there was a different view for HRSA, but HRSA and all of us are evolving and learning more, and the requirements becoming more stringent.
Great. And the second part of that question was, are these new requirements that will be audited going forward? I just want to point your attention again. I pulled up the slide, time and effort in the Ryan White HIV/AIDS program. These questions come from the Part C and D site visit assessment tool. So these are the questions that consultants will ask when they come to your site. And so it's a really good idea to go through this checklist on your own and to try and see how you match up. If you're interested, we can have us in-house or a consultant, for example, look at the way that you're currently doing time and effort to see if you're compliant, in case you're concerned that you are not. I'm going to look at a few more questions now. Our electronic time tracking system is based on allocation and not necessarily time worked. In this case, I'm assuming the time and effort logs would be important.
Yes, they have to be on actual time. What you're saying when you say allocation, I'm assuming it's a predetermined allocation. And so what the government really, really wants is that actual based.
Thank you. And Jenna, we have another question that I'm going to ask you. How does program income factor into this? If program income is paying all grant expenses for a portion of the year and is not subject to the administrative cap, how does that factor into time and effort?
That's a great question. I saw that one come through. Again, program income seems to be something that's changing a lot more, that programs are really having to deal with a little more because of the Affordable Care Act, and programs are experiencing more income with 340B funds and things like that. So what we have been encouraging in the site visit world is having people treat their program income like a budget, and having that as a budget run concurrently or parallel with your Ryan White Part C or D funding. We have issues where a program will use all the program income first, as the rules state, and not make it to spending their grant funds. So it's really better to have your program income funds being used to concurrently to support your program and have it obligated for, some expenses for your program versus your grant funding. So your grant funding is used how you said it was going to be used for your work plan, and the program income is used concurrently. So I would maybe set it up as another funding source, say, Ryan White Part C program income, and apply administrative time to that to keep it separate, because it's not your grant funding. It is a more or less a different funding source that you could just treat as another category.
I would just add one more point, and that is, again, if this was your only source of funding for grants, and you say, how is that money, A, being used? And the second thing, most importantly, is, but if you make an exception for that, and you've got other specific grant-funded things under Ryan White or others, it's hard to have exceptions and say, this award, we don't have to worry about timekeeping, and this award we do. And that's the breakdown of internal controls. The internal controls, unfortunately, force you, once you got one federal award and you still got that active, even if you have program income as a source of funding, you start to mess things up because people are going to forget.
Right.
So that's why you force them into this.
Right. Great. Jenna, we have another question. It's a fantastic question from Julie. How do you charge the time spent completing and reviewing effort tracking? Does every employee have to have administrative time allocated to complete the effort tracking?
That's a good question. We don't. I mean, we haven't been giving people administrative time, because some of the time, the people who are providing medical services or support services that are supported by patient logs, their time and effort is pretty easy because it's just based on the reports that they're doing. So they're able to pull a report out of CareWare or whatever of the patients that are served and fill out their time and effort log that way. So we have not been charging each person's time and effort time to administration. We haven't been doing that.
We have another question down here that I'm going to ask to Paul. If we're currently basing time and effort off of allocation, how much time do we have to roll out a new process based on actual, considering how laborious this seems? Have you heard of any, does it say anything in uniform guidance in terms of what that process should look like?
No, they never give you that kind of detail. Do you think they would do that for you?
I just thought I would ask.
Whitney, you have a great question. This comes into what we call a transition process. And so you would need some perhaps help or something to transition from one to the other. Obviously, the sooner the better. Say you're, now we're in July, but if let's say you had a 6/30 fiscal year end and you're just starting in July, maybe these are something you would implement now. Maybe you say, okay, HRSA, we have a plan to change, and our fiscal year ends 12/31. So our new fiscal year or our next quarter, try to think of this as a transition plan. Do it methodically. If you need you need to set up a plan and the resources to get it done. The government would understand that and say, we recognize this is not that pre-established allocations are not the best method. And so our plan is over the next 6 months is to do an analysis and what kind of system we can go to. But by the 1st of January, our next fiscal year, we plan to do it on actual based time reporting. So what I'm saying is every situation is going to be different, but if you write up a plan, I don't know why, but I think everybody in the government respects the fact that you have a work plan to transition. Right. And then you kind of cover yourself. That's the best I can do.
Right. Jenna, if you were going on a site visit and, for example, someone were in the process of transitioning this, what would you talk about, or how would that be reflected in their findings?
So typically, this is a typical thing that happens. You know, they look through the module, and then the program is like, oh, you know, we're supposed to be doing this, and we're not, or we're not doing this up to the par. So often when we get on site, the grantee will have, you know, this is our policy that we're talking about rolling out, and we can talk through it and offer technical assistance on site to say, yes, this would work, and kind of talk through ways to improve it. And then the finding would say, you know, they have worked on a policy and procedure, they're working on rolling it out, and then there would be some accountability with the project officer on making sure that you stuck to a timeline and did eventually roll it out. So it may still show up as a finding, but mainly is so that it can be on your corrective action plan, and your project officer can kind of follow up to make sure that the plan does go into play. And when you do a corrective action plan, you really work with your project officer to determine a timeline that's going to work for your program. So like Paul said, if it's going to take you a couple months to implement that, that's what you tell your project officer on the corrective action plan. Look, you know, this is what we're wanting to do. This is when we feel like we can roll it out, and you guys just stay on top of making sure that comes into play for your program.
Great, and we had a follow-up question to that. If they have a June 30th fiscal year end, would you still recommend a 6-month rollout, Paul?
If it takes that long for you to develop something, and you've got some really, really intricate methodologies here and processes, then yes, I would take the time to do it, and I would write up a plan to show the government that you're putting time and effort in a different way to establishing a new system, and maybe electronic or detailed. You know, you may not find an electronic system that does the service categories. Maybe there's some that allow you to populate a lot of fields, and you can do it. Mm-hmm. But yes, if you have something that's very intricate and it's just not something so simple you can do it, you're going to need the time. But try to limit it no more than 6 months, even 3 months if you can. Also, think of it this way, Whitney. Maybe I'm not sure if this is true for you, but what if a lot of your awards came out October 1st? You know, even though you're in the middle of your fiscal year, but you're starting your next grant year, and of course they're different years. That may be a goal to do too. So definitely by the time you have a rollout of a lot of new awards, but it's going to be a personal decision for Absolutely. Each entity, and I can't give you the answer. The sooner the better, but I understand it may take some time.
Absolutely. Thank you so much for that. We have another question that I would like to address here. That's so the slide currently being shown asks, from the site visit tool, are employees required to complete time and effort reports? How does this square with what has been said about time and effort reporting not being appropriate for nonprofits? I want to make it clear, time and effort reporting is absolutely required, and for nonprofits, time studies are not appropriate for nonprofits to demonstrate actual hours worked. So the whole process of what we've been talking about is time and effort reporting. Time study is a particular method of time and effort reporting. So I just wanted to clarify that. We've had a number of questions that were asked about specific softwares for this. As a HRSA HAB funded entity, we are not going to recommend a specific software that works. However, we would be happy to provide folks with some examples of what they might currently be using. We are going to send a follow-up email after this with the slides, with some resources attached with our evaluation link. And I'm going to ask people if they can kind of write in telling us what they use. And I'm happy to provide that list of software overall, but we aren't going to be able to recommend one kind of software. And I just wanted to make that clear. We had one final question, and then I think that was the last one for now. If I didn't answer any of your questions, it means that I'm going to get back to you personally to answer them, because some of them are a bit too specific or more related to other topics than this webinar. So our other question is, besides the uniform guidance, what additional HRSA HAB policies are you basing these recommendations on? All of this really comes from HHS uniform guidance. Because HRSA HAB is part of HHS, these recommendations apply to the Ryan White community as well. The questions that I have up here on the slide, again, come from the C&D site visit assessment tool, which we have kind of interpreted here as policies. For those of you who might be receiving, who are subrecipients, it's also possible that the recipients have outlined specific reporting requirements that they need. So there could potentially be multiple levels of reporting requirements depending on how you get your funding. If you have any other questions, again, my email is I'm actually going to type it in the box here right now. It's up on the slides, and we will get back to you personally if we haven't answered your questions. I really want to thank Jenna and Paul for their presentation today. Again, we're trying to find some time and effort policies and procedures. We're happy to send them out. The more that we have, the better. If you think you have one that's great or even good, please send it to us. We're happy to work with you to make it even stronger. So thanks again for being with us today, and we hope to hear from some of you with other questions or if you need help with technical assistance. And also, I just wanted to remind you, if you could please fill out the evaluation. The link is in the folder icon that's at the bottom of the screen. I am going to leave the webinar room open for a while for folks to download some resources, but I will end the call at this time. So thank you so much, everyone. Take care.